My name is Herbert Castillo Valladares, and I am an assistant professor of dermatology at UCSF. I also serve as the director of the inpatient dermatology consult service at San Francisco General Hospital. I love being an academic dermatologist, and my job really allows me to fulfill my mission to advance dermatological care for underserved communities. And I get to do this in various exciting settings. So, my work week begins at my faculty practice in Mount Zion, where I take care of a very diverse panel of patients who come from all over SF and the Bay Area with to address their medical dermatology needs. And the rest of my clinical work is based at San Francisco General Hospital. And there I care for patients and also teach what I believe is the are the most amazing and best residents in the country, dermatology residents in the country. And I do this in the outpatient setting and also in the inpatient dermatology consult service. My academic focus right now is on finding avenues for advocacy for migrants, asylum seekers, and refugees. And I'm doing this in two different ways. So one of the ways I'm doing this is creating a clinical forensic dermatology, both education and research program. And what clinical forensic dermatology does, it supports the work of asylum health. So usually when a patient wants to seek asylum, what they do sometimes is they have a medical evaluation that supports their legal case. And in these medical evaluations, a lot of the times, skin findings are the most common and easily identifiable forms or evidence of torture, abuse. Um, and so what we do is we focus on these findings as potential evidence that can support the legal claim. And so what we find is that this work really enhances the work of asylum health. And what we're doing right now is creating both a dermatology curriculum so that dermatology residents know how to do this work and are become a little bit more interested in becoming a part of asylum health. And we're also creating an educational module so that asylum health providers who are not dermatologists are better equipped to describe skin findings and know how to produce the evidence that's supportive of a patient's legal case. The second thing that I'm also doing is that currently in dermatology, patients are very underrepresented in clinical trials, specifically Spanish-speaking Latina patients. And what these clinical trials often use are patient-reported outcome measures. And these are questionnaires that patients use to detail their health experiences. And right now, there's no validation of many of the common measures that are used in dermatology for Spanish speakers. And what we're doing is validating these measures so that we can um, hopefully create a tool that can then be used to recruit more patients in clinical trials. My work centers on historically marginalized communities like refugees, migrants, asylum seekers, and also Spanish-speaking individuals. And dermatology currently is one of the least diverse specialties. And so it historically hasn't been paying a lot of attention to these populations. And so the work that I'm doing is really meeting a need that historically has been excluded from scholarship and also advocacy within dermatology. So a lot of the work that I've been doing regarding clinical forensic dermatology is in partnership with the UCSF Health and Human Rights Initiative. So this is the organization that coordinates all the pro bono medical evaluations that are done at UCSF, the medical evaluations for asylum seekers. More broadly, a lot of the medical education that I'm doing as far as the curriculum for dermatology residents is a multi-institutional effort. So this is a curriculum that has been disseminated to 7 different residency programs. And the other educational module that we're doing for asylum health providers who are not dermatologists is through the Asylum Medicine and Training Initiative, which is a collaboration of asylum health professionals and experts that create educational modules that are free of charge for people who are interested in gaining more training and education regarding medical evaluations. I'm extremely honored to be named a John 8 Watson Scholar. I think past recipients really have a proven track record of being leaders in diversity, equity, and inclusion, and have a proven track record of really affecting systemic change. And so I'm really excited to join this cohort of amazing individuals. More broadly, I think this award really is a concrete example of how UCSF is really leading the charge in creating a more inclusive academic environment. And this is particularly important for specialties like dermatology, in which racial and ethnic minorities are severely underrepresented.